Good afternoon, and thank you so much for joining us today for the COVID-19 Vaccine Town Hall, Accessing Vaccines for Children Under 5 in New York City. My name is Dina Pimenova. I'm the Senior Project Coordinator for the NYU Langone Community Health Worker Research and Resource Center, housed in the Department of Population Health at NYU School of Medicine, and supported by the NYU Langone Community Service Plan. Today's event is co-sponsored by the NYU Langone Community Engagement Alliance Initiative, NYU CUNY Prevention Research Center, and the NYU H&H Clinical and Translational Science Institute. Next slide, please. Before I introduce our speaker, I would like to review some housekeeping. Everyone is on mute. You can enable or disable closed captioning by selecting live transcript at the bottom of the screen. The chat box is open for comments and sharing of resources. If you're trying to reach all attendees, please select everyone, not just hosts and panelists. We ask that you please use the Q&A box to submit questions to the speaker. We will have time to answer as many questions as possible during the Q&A portion. The slides and the recording will be made available. I will email those out as soon as possible, and please be sure to fill out the polls that we will have during the presentation and at the end of today's webinar. Next slide. This webinar is geared primarily towards community health workers and frontline staff working directly with community members. We will first have a presentation on how caregivers can access vaccines for this newly eligible population and New York City Department of Health and Mental Hygiene's progress in their efforts to address vaccine inequities in New York City. This will be followed by a Q&A. Today, we're excited to welcome back Dr. Simbo Ige. She's the Assistant Commissioner at the Center for Health Equity and Community Wellness at the New York City's Department of Health. She leads the COVID-19 community and partner engagement efforts to ensure equity in access and uptake of vaccines by all New Yorkers. She leads the community engagement efforts to advance COVID-19 vaccine equity goals. In addition, Dr. Ige oversees the Public Health Core Initiative, a partnership with over 80 community-based organizations working to address COVID-19 health inequities in priority neighborhoods across New York City. Dr. Ige is a public health doctor with degrees in epidemiology, biostatistics, and public health. Our Q&A moderator today is Patricia Hepburn Moody. Mrs. Moody has been part of the Harlem community for over 30 years. She has served as a community outreach coordinator at the Herbert Irving Comprehensive Cancer Center at Columbia University and grants and community relations coordinator at Memorial Sloan Kettering's Ralph Lauren Center. Currently at NYU Langone's Beatrice W. Walters Breast Health Outreach and Navigation Program, Patricia guides men and women through the healthcare system from breast and colorectal cancer screening to diagnosis and treatment and survivorship. Her activities aim to eliminate any barriers to care through delivering breast and colon health education programs in community-based venues. And with that, Dr. Ige, the floor is yours. We will stop sharing our slides. Thank you.
Good afternoon, everyone, and welcome to this conversation. I am the Assistant Commissioner for Health Equity Capacity Building, and I work for the Department of Health. Now, the Department of Health is tasked with promoting health and safeguarding the health of 8.3+ million New Yorkers. We have been in the throes of this pandemic for 29 months. We are now in the 29th month of the COVID-19 pandemic. And we have been working hard to ensure that all New Yorkers are protected. This pandemic has been characterized by highs and lows that we call wave. So we have periods of high transmission, and then it goes down a little, and then it picks up again. And we have just come out of our 5th wave of the pandemic. Today, I am going to talk about vaccine equity. We know that this pandemic has taken a toll on all New Yorkers, but some populations have suffered more than others. And part of our work to ensure that all New Yorkers are protected is to ensure vaccine equity. So I will start with a quick update before we launch into this new exciting vaccination. Just a little snippet of the journey today. So our focus today, we want to share with you the impact of community partnership on vaccine equity in New York City. We wanted to achieve vaccine equity, and very quickly we realized we couldn't do it alone. And then I will talk a little about COVID vaccines for children under the age of 5 and where we go from here. So, quick snapshot. Today in New York City, we have administered 17.9 million doses of vaccines in the city since vaccination started in December 2020. That means 6.5 million people have completed their primary series in New York City. 79% New Yorkers have completed their primary series, 88% of adults and 60% of children. And boosters are now available. At this point, only 39% of New Yorkers have received the additional dose. Why is this important? We couldn't have achieved the progress that we have made without partnership. So first lesson that we learned is that local health departments cannot act alone to create healthy communities. We need partnership. We need trusted messengers to help get information across in a way that is culturally and linguistically appropriate. One of the ways that we have done that I want to celebrate today is our community partnerships. And these are just the community partners that we have contracts with. We have worked with hundreds of faith-based organizations, several community boards, several individuals who have been part of this journey. But we have a public health core initiative where we have contracts with 85 community partners to serve 74 zip codes that were identified by the Task Force for Racial Inclusion and Equity as priority. Through these partners, over 1,000 community health workers have been hired, and every week they engage, they provide education, they provide resources, they help link communities to additional resources to over 100,000 people. And weekly vaccine referrals and appointments to 12,000 people every single week. They provide information in several languages, including the one that I've listed here. And this is the spread of this partnership across the city. So when we say that 99% of adults in New York City are vaccinated, this is the reason why. This community partnership has been instrumental. We also want to say peer-to-peer engagement is what builds trust. This pandemic, it became very obvious that, strutting around the neighborhood saying I'm a doctor from the Department of Health doesn't necessarily change minds. That peer-to-peer, people go to their peers for information, and this is how trust is built. And we invested a lot in this peer-to-peer engagement through our community partnership. And this is just an example. This is one of our community partners, Smart University. And this is outreach from women to women. These are women ambassadors. These are youth ambassadors on the street wearing their t-shirt to ask me about the vaccine. And so it has taken a lot of work by every New Yorker. So I don't stand here taking credit for all of this work, but I want to highlight and acknowledge that it has taken a village to get us where we are. We also want to acknowledge that equity takes time and no doesn't mean never. So in many communities, when we started this journey, all we heard was vaccine hesitancy. And for due reason, for just cause, some communities were taking their time, they were a bit more cautious. But we recognize that that was coming out of a place of the experiences that they have heard with the healthcare system and public health system. And so to achieve equity, we needed to be patient, we needed to use trauma-informed approaches, and we needed to stay the course. And this is what that looks like. So today we celebrate the progress we have made in achieving health equity. Health equity means that some people are 40 feet ahead and some people are 200 feet behind. And we want to close that gap. So when we started our vaccination initiative, the orange line there is NYCHA. The residents of NYCHA had only 39% vaccination coverage. You see this orange line climb slowly and steadily until it caught up with the rest of the city and overtake. And now we're very proud to say NYCHA resident vaccination coverage is at 93%. And in the 3 neighborhoods, that's the Task Force for Racial Inclusion and Equity neighborhoods, where we were 48%, we are now at 85%, catching up with the rest of the city. And these are all of the milestones along the way: policy changes, $100 incentive, vaccine mandates, etc., that contributed to the success. So I want to start by saying, yes, we have children vaccination, but we have learned a lot over this 2-year period on what it takes to get New Yorkers on board and to a place of vaccine confidence. And I want to share some stories, because we talk a lot about vaccine hesitancy, and we're changing the narrative to talk about vaccine confidence. And we asked New Yorkers, will you share what helped you make your decision to get vaccinated? And this is a quote from one of the residents served by the Smart University. After seeing the immense number of people being affected by this virus, whether physically or mentally, the thing I wanted most was for it to be gone. I got vaccinated to save lives, my older family members, my friends, myself, and even people on the street. Folks, New Yorkers are motivated by the love they have for their community, for their family members, for their loved ones, and even for the greater community. This is why people are getting vaccinated. These are 2 other stories. My God told me not to let fear get in the way of serving others. This is a young person, 29, saying, I was very hesitant to get the COVID-19 vaccine. I was the last of my siblings to get vaccinated. And what changed my mind was hearing their reasons for getting vaccinated. I work with young children, and for me to not get the vaccine, especially when I am fit to do so, will be thinking in my own interest and not caring for those I work with and live with. I couldn't put others at risk. I am sharing my story because I think it's encouraging for others who are hesitant to get vaccinated to know that the vaccine is safe. Stories matters. Stories matter. Testimonials matter. And the story of the success we have had to date matter. As we take on this new challenge, we want to remind all of our partners, all of the folks who are on the front line, that New Yorkers did their bit. This is a middle-aged person saying, I was on the fence before, but I'm glad I got the vaccine. I'm constantly around my mom and uncle who are in their 80s, and I don't want to be a risk to them and possibly spread the illness to them. I'm relatively healthy, but I'd rather be safe than sorry and protect those around me. In addition, what I've read shows that 80% of those hospitalized and dying are unvaccinated. Getting the vaccine will also help keep the burden off of hospitals and healthcare workers who are under strain now. New Yorkers care. They care about the impact of the vaccine. They care about staying safe and protecting their loved ones. So this is our call message as we go into vaccines for children. We want you to be prepared for the frequently asked questions, but we also want you to go in confident that New Yorkers want to do the right thing, and many are just struggling to find the right information and get the right details to help them make that decision. So before we get started, let's do a quick check-in if you don't mind. I want to start with just a quick assessment of how comfortable you are responding to community members' concerns about getting the COVID-19 vaccine for children. Would you say you're not comfortable at all, or you're uncomfortable, or you're not sure? It could go either way. Or would you say you're fairly comfortable or extremely comfortable? Thank you for participating. This is anonymous, so feel free to be yourself and share exactly how you feel. Okay, I think we got all the answers in. We'll give you 3 seconds. 3, 2, 1. And thank you for participating. Yes, you may share the results. It looks like a lot of people are fairly comfortable talking about this vaccine. Some people are extremely comfortable, which is very encouraging. Some people are not sure, and some people are uncomfortable. So this is why we're here today. We want to make sure that you are familiar with some of the frequently asked questions that you may get, such that if there are questions that come your way, you feel comfortable responding to that question. Now, let's start with, okay, so now we have vaccines for children. What does that mean? It means that everyone now, age 6 months and older, can now be protected from COVID, including severe COVID, including death. Both Pfizer and Moderna vaccines are now available for children as young as 6 months and older. The dosage varies for Pfizer and Moderna based on age and the manufacturer, but the good news is all members of the family, all New Yorkers aged 6 months and older can now get some protection from this virus, which is really important. Is the vaccine safe for children? Yes, yes, yes. How do we know this? Because carefully conducted studies, including thousands of volunteers, showed that the COVID-19 vaccines are safe for children in this age group. Now, the process of getting to authorize a vaccine for use is that the vaccine must go through 3 phases of clinical trial. Phase 1, usually less than 100 volunteers will participate, and the goal there is to establish that the vaccine is safe. Phase 2, you have to do a couple hundred people who will volunteer to use this vaccine, and then your goal there is to establish that the vaccine is effective. Does it actually prevent infection? Does it actually prevent severe disease? If the answer is yes, then you will be allowed to go on to phase 3, which is thousands of participants volunteering to use this vaccine so we can determine if it's both safe and effective. And for children, we had thousands of children participate in phase 3 before these vaccines were authorized. So the COVID-19 vaccine has also been successfully administered to billions of people all over the world. I started with some data to show you that in New York City, we have administered over 17 million doses of vaccine. These are real human beings. We know them, we see them around us. They are doing well. So it is the exact same vaccines that children are getting. So we are confident that these vaccines are safe for children. Why is it important to vaccinate children when most children only experience mild symptoms? Is it worth it? That's one area where parents struggle. As a mother myself, what will I do? Will I expose my child to this vaccine? Is this vaccine safer than getting COVID? And the answer is yes. Children can still become severely ill or die from COVID-19, and we never know in advance who is going to become severely ill or not. With the vaccine, we know what we're getting. It protects other children and adults at risk of severe illness. I started with a few examples of what is it that motivates people to get vaccinated, even when they are relatively healthy. They say because they are concerned about older family members, they are concerned about the children that they serve, etc. So children getting vaccinated is for the same reason, not only because we want to keep them safe, but also because we want to keep older people who may be at higher risk of severe illness safe as well. Children can also experience long COVID. Millions of people now are living with long COVID. 1 out of every 3 people who get COVID now have long-standing symptoms, including mental health symptoms. So in children, we're seeing brain fog, that is inability to concentrate as a result of having had COVID. So these are some of the reasons why we want children also to benefit from the protection that the COVID-19 vaccine offers. So other questions that we get commonly: my child has already had COVID. Do they still need the vaccine? The answer is yes. Children who have already had COVID will be protected for a while. It is the same antibodies that are developed whether you've had COVID or whether you get vaccinated. If a child has had COVID, right now the recommendation is they can wait 90 days after they recover from COVID, after they're diagnosed with COVID, to get their vaccine. People who had COVID-19 and then get the vaccine have very, very strong protection from future infections. I'll say that again. Let's say a child got COVID, You can wait 90 days after that diagnosis for them to get vaccinated. We have seen that reinfection does not occur within those 90-day periods. So it is okay for the child to wait 90 days and then they can get vaccinated thereafter. But having COVID in the past does not exclude you from getting vaccinated. Side effects. This is the piece where you will see a lot of scary things on the internet and people are worried about what is true or what is not true. There are some symptoms that you may experience when you get vaccinated. Now, these symptoms or side effects are similar to what kids exhibit when they get other vaccines. For those of us who are parents already, children get as many as 19 different vaccines when they're growing up. And all kids are required to be vaccinated before they go to childcare or before they go to school. So vaccines are not strange to children. And so when we say the side effects are similar to other vaccination, that's what we're referencing. The most common side effects for COVID-19 vaccine is the same as other vaccines. The child will cry, there will be pain at the injection site, they may be irritable, they may not want to eat, a little loss of appetite, they may be sleepy or tired or have low-grade fever. These are common side effects that children show when they get vaccinated. And you know also this only lasts a couple of days, 1 to 2 days, and then they're back to normal. So this is the same for COVID. So we don't want parents to be alarmed. So if you get questions around what can I expect, like some kids may exhibit the symptoms, but don't worry, 1 or 2 days and they'll be back to normal. Will the vaccine affect my child's future fertility? Now, this is a question that comes up a lot on social media, but I like to say to people, if 7.5 million people in New York City alone are already vaccinated, if 60% of the entire world's population are vaccinated, we know for certain that people are getting pregnant, people are starting their families every day, and we haven't seen any change in that. So there is no evidence that the vaccine affects fertility. So the answer is a robust no. The COVID-19 vaccines do not affect puberty or future fertility. Many people have received the COVID-19 vaccines all over the world, including here in New York City, and have successfully started their families thereafter. I think we've had more babies now with COVID than we've even had in the past. I have 3 people in my department alone who have recently had babies, and they're all vaccinated. So the vaccine does not affect puberty or future fertility. Do we have information on the reports of heart problems, myocarditis, pericarditis after the vaccine? Yes, for the clinical trials for these 2 vaccines, Pfizer and Moderna, there was no report of myocarditis or pericarditis among those who participated in the clinical studies. Now, what is myocarditis again? It is the inflammation of the heart muscle, and pericarditis is inflammation of the heart covering. It occurs in adolescents and young adults after getting the Pfizer or Moderna vaccine. It causes chest pain. The cases that have been reported have gone away quickly after rest and treatment. And the cases are very rare, just a couple people per million. So we want to reassure parents, we haven't received reports of myocarditis or pericarditis for vaccination in children under the age of 5. Can my child get a COVID-19 vaccine during the same visit as other vaccine? Absolutely. Yes, COVID-19 vaccine can be safely co-administered with other vaccines. So we are encouraging parents to not only catch up on their routine childhood vaccination, but to also ensure they get COVID during the same visit so that they don't have to schedule a different appointment for COVID. So yes, your child may get the COVID-19 vaccine together with other recommended annual vaccines, including the flu vaccines. So what do we tell parents? We tell parents to use their pediatrician offices for vaccination whenever possible, so that their babies and young children can get all other important vaccination in the same visit. For those parents who don't have a pediatrician, the City of New York will have vaccination hubs open for about 8 weeks. We have 10 hubs, and they will be open until the end of August to support the rollout of the baby vax. The health and hospital sites will also have vaccines, and routine childhood vaccination will be available at the health and hospital sites as well. The vaccination hubs will not have other routine vaccinations, just the COVID-19 vaccines. And parents and guardians must consent to have their child vaccinated. We cannot vaccinate a 4-year-old without the parent's consent. Children younger than 15 years must have an adult with them when they get vaccinated. They may come with a written consent, or they may have consent on the phone, but they need to have an adult with them if they are under the age of 15. To find a vaccination site around you, you can call 877-VAX4-NYC, or you can check the COVID-19 Vaccine Finder website to find where there are pediatricians around you providing these new vaccines. So some more information about the city vaccination hubs. The city vaccination hubs will have just the Moderna baby vaccine. And it is for children 6 months to 5 years old only. And we started vaccinating June 22nd. The city-run vaccination hub will run for 8 weeks, as I said before, until August 2022. We stopped the mobile vaccination vans 30th of June. So after June 30th, families should talk to their healthcare providers to see if their providers offer COVID-19 vaccines. So the mobile vaccination vans are not available. The city vaccination hubs will have vaccines just for babies for 8 weeks. Thereafter, families will need to get their vaccines either at their providers or at pharmacies. The Vaccine Finder is the best site to get information on where vaccine is available and for what ages, or call the 877-VAX-NYC. These are the different locations for the city vaccination hubs, the days of operation, and the clinic appointment hours. Again, we recommend that parents use their pediatrician offices for vaccination whenever possible, so they can get their other vaccinations during the same visits. If you do not have a pediatrician, the city will open vaccination hub for 8 weeks. Health and hospital side will also have vaccines. We have social media kits, we have baby vaccine FAQ, and we have kids vaccine FAQ to help you share. So I started by showing you some examples of the testimonies or the community experiences that led to making a decision for the vaccine. So if you're out there and you are a frontline worker, you're a community health worker, you are in a position where someone is asking you about the vaccine and you want to provide an answer, we have some tips on how you can practice conversations with community members about the COVID-19 vaccine. And we have put together, it's called an acronym, it's called NORTH, which is an acronym for Normalized, Open-Ended, Resources, Together, and Honest. And I'll tell you quickly what that means. So when people ask us questions, even though it may be from misinformation, we want to validate their concern. Assure clients that it is normal to have questions and concerns. So let's say a parent comes to you and say, I am concerned about these vaccines. I have heard that the vaccines cause fertility. We want to start by saying, I hear you. I can understand why you will be concerned if you hear something like that. So people feel heard and they feel their concern is recognized. We want to also ask open-ended questions. We want to ask questions to better understand their concerns. Have they, heard these concerns from other people? What has there been their own vaccination experience, etc. If the client shares incorrect information, please do not correct them. Avoid also repeating misinformation. Acknowledge what they have said and like, oh no, okay, I hear you, I know where you're coming from. And then please share culturally and linguistically appropriate resources from trusted, reputable sources. And like, oh, I hear you, this is what you have heard, but I can only share what I know. And these are from the sources that are the public health experts or scientists that are experts in this field. And these are some resources that I have that talk about fertility. The Department of Health has shared with us that several million people have been vaccinated. Many of them have successfully started families after that and have had babies. So These are the sources of information that I have. And you can also work together, help this parent or individual explore other options. It isn't your job to convince people to get the vaccine. People can feel pressured or burdened, and that's not always productive. Instead, we want to work with community members to ensure that they have accurate information that they need to make the best decisions for themselves and their family. So what we want to do is provide information so they have all sides of the story and not to make them feel pressured to make a decision. And then share honestly. We have found that lived experience matter. If you're vaccinated, we have had some of our community health workers say, you know what, this is my own vaccination card. I have got the 2 vaccines and I've also got a booster and I'm doing well. And I know several other people who are already vaccinated. We see that people relate to those experiences more than trying to become an expert and feeling like you have to reel out all the data or all the scientific arguments to convince this individual. It is also okay to say, I don't have all the answer. I don't know. I only know that I am vaccinated and I'm doing well. And I know that all city employees are vaccinated, are required to be vaccinated, and they're all here. I don't have all the answers, but you may also want to talk to your pediatrician or talk to other providers that you have relationship with who can give you more information. And I can also share with you a website where you can check for more information should you need it. So these are some examples of how you can approach that conversation. And I want to end the way we started this session. If you don't mind, if you will, after this conversation now, reflect again. Do you feel you have some additional answers? Do you feel a bit more comfortable than you did before? Let's know how you feel, and then we can launch into the question and answer to address other questions you may have. Thank you. We'll give it a couple more minutes so people can get their answers in. Right. So 3 seconds, 3, 2, 1, and this is where we landed. A lot of people are fairly comfortable and extremely comfortable. There are still people who are not sure if they will, do this or not. And there are a couple of people who are still not comfortable. So I will stop now and we'll transition to, we have some resources here that you can check out when you have a minute to help with some conversations that some other questions you may have. And I will stop there and we can transition.
Hello, doctor. We do have a few questions for you. Can you hear me?
Yes.
Great. Is the vaccine for children under 5 a lower dose than the adult receives?
That is correct. Yes, it is a lower dose. So for the Pfizer vaccine, it comes in a 3-dose series, and each dose is 1/10 of the adult's dose. So I will say that again, for the Pfizer vaccine for children under the age of 5, it is 1/10 of the adult's dose. For the Moderna vaccine, it is 1/4 of the adult's dose, and it is given in 2 doses, the first dose and then the second dose 4 weeks after.
Okay. Are there any long-term effects on children getting the COVID vaccine? And how long in their body?
Okay, so I will start with what we know from adults. Vaccination started in 2020, and so we've had over a year of watching these vaccines play out. We haven't seen any side effects emerge after 6 weeks of being vaccinated. And the reason for that is that these vaccines don't linger in your body. The vaccines contain mRNA, which is a messenger RNA. The mRNA is a messenger. Its job is to send instructions to your body, which eventually leads to the development of antibodies. Antibodies are proteins that help you to fight invaders, that help you to fight germs. Now, the messenger does not stay in your body. The messenger delivers the message, and then it is eliminated from the body. So this is why we are not expecting any long-term effects, because the vaccines don't stay longer in your body than a couple of weeks after the vaccination. So it takes about 2 weeks after your vaccination, the primary series is completed for the antibodies to be fully developed. And once those antibodies are developed, the vaccine is eliminated from your body. The vaccine is just a messenger sending a message to your body to develop antibodies. That's it. So we don't expect long-term effects beyond some of the side effects that we have shared with you earlier.
Okay, great. Do you think in the future of antibodies can stay in your body longer for your life?
So antibodies, again, to clarify, antibodies are proteins that help us to fight germs. Your body contains trillions of antibodies at any one time. Some antibodies are specific for certain diseases, and they may be present in your system for a while, and then they will go down. For COVID, we have seen evidence that these antibodies only stay in your system for a while, and then after that, they go down until they become undetected. So this is one of the reasons why we encourage boosters, because after about 4 to 6 months after your second shot, the antibodies tend to go down, and this is what causes reinfection with COVID. And so boosters help to, again, show up those antibodies as needed. So that is how the antibodies work. We don't have, right now, those antibodies don't stay permanently in your system. They last for a while, and then you need a booster to show up that protection again.
Wonderful. During the initial testing for the vaccine for children under 5, were there any hives or rashes or fevers with young kids?
Hives or rashes. So hives is a sign that there's an allergic reaction. Is it possible for some people to be allergic to the vaccine? The answer is yes. So we can have allergic reactions to vaccines. In this trials, we did not report any case of allergies to the best of my knowledge. But again, the trial only involved certain thousands of people. There may be some people who have allergies to vaccines and will not know it. But this is one of the reasons when vaccines are administered, each person is observed for 15 to 30 minutes. If a child already has a history of allergies to other vaccines, they will be observed closely by their pediatrician and an allergist to ensure that they know what to do if there is a reaction. For most people, they will be observed for 15 to 30 minutes if there's any reaction, so that it can be treated on the spot. So that is the plan for if there's an allergic reaction. Allergic reactions are very rare from the data we have to date.
Wow. What percentage of the vaccine study included African-American children?
I don't have the numbers off the top of my head for the breakdown for children. I have the numbers for adults. For the adult vaccination, about 15 to 20% of the participants were African American. Why is that important? It is important because we were included in the development of this vaccine. We are part of the solution. It is important to note that race is not a biological construct. We are not biologically different from folks who are white. Race is a social construct. It is a system that was developed to categorize human beings. So biologically, we are not different. So when we say Black folks were included in this process, it is to ensure representation rather than because there are biological differences. The vaccine works the same in people of different race and ethnicities, and we participated in the clinical trials as well. It is also important to know that Moderna, one of the lead scientists for developing Moderna is Kizzy Colbert, an African-American doctor working at the National Institutes of Health. So I got Moderna for that reason, because it was developed by a Black woman. Yes.
Wonderful. Are there any illnesses that prevent a child from getting vaccinated?
No. We don't have any contraindications for this vaccine. That means there is no medical condition that will preclude you from getting vaccinated. These vaccines are safe, again, because they don't contain the virus. They only contain a messenger. So they don't interact with medicine. They don't interact with other medical conditions. So regardless of your child's medical history, they can be vaccinated. If your child has an allergic reaction to vaccine, please discuss with your pediatrician first, but medical conditions are not a barrier.
Wonderful. Are there any special recommendations for children with autism?
No, there is no association between vaccines and autism, and autism is a result of complex genetic factors, but there is no limitation to getting vaccinated, and vaccines are not linked to autism.
Okay, wonderful. Does the vaccine have a new variant that's swiftly emerging because of the dominance?
Yes. So when we started this journey 2 years ago, we were dealing with a version of the COVID-19 virus. Over time, that virus has mutated, resulting in different variants. Some of those variants have emerged with more problems than we had before. That means they could cause more severe illness or could escape the vaccine or evade the protection that you have from previous infection. So right now we have had over 17 different variants, and now we have a new variant that is called BA4 and 5, which is even more contagious, more aggressive than previous variants. Now, do the vaccines still work for these variants? Yes. Not as well as they worked for the original virus, but they still work. There are talks ongoing about updating the vaccines to respond to the newer variants. We don't have those vaccines yet. It may be that there will be boosters in the future that will be more specific to the newer variants. But what we know right now is these vaccines still offer robust protection against severe illness and hospitalization, even with the variants that we have at the moment.
Great. We talked earlier about the immune system and the fact that we have to get a booster 4 to 6 months. Does this apply to children also, children under 5?
Yes, it's early days for children under 5. It is right now, we don't have boosters recommended because they only just started the vaccination series. But for everyone age 5 and older, a booster is recommended 5 months after they complete their primary series. So anyone 5 years and older that has received their first 2 doses, 5 months later, they should get a booster.
Okay. Question. Why don't we hear about other vaccines other than Pfizer and Moderna?
Each country is different. The World Health Organization has a list of approved vaccines. Those approved vaccines are the ones that have been subjected to review, that have provided data for how that vaccine was developed, all the clinical studies and that have been reviewed by a panel of experts and independent reviewers, and it has been concluded that those vaccines are safe. If that kind of data is not available, the WHO does not approve that vaccine. So there are different vaccines used in different countries, but all approved vaccines are on the World Health Organization list. In the United States, we had 3 vaccines that were in use: Pfizer, Moderna, and Johnson & Johnson, all of which went through rigorous reviews, including hundreds of independent reviewers before they were authorized for use. Johnson & Johnson vaccine was a single-dose vaccine that was authorized for use last year, but the CDC has recommended Pfizer and Moderna as preferred vaccine. This is because Johnson & Johnson caused blood clots in some people who had a blood condition called thrombocytopenia. And since Pfizer and Moderna don't have that problem, it is recommended that everyone now just take Pfizer and Moderna. So in the United States right now, Pfizer and Moderna are the 2 vaccines approved by the Food and Drug Administration, approved by the Advisory Committee on Immunization Practices, approved by the CDC for use in the country. Other countries have other types of vaccines that they use as well.
Okay. Do we have memory T cells with Pfizer vaccine? And
yes.
What's used to deliver the mRNA in each cell?
Yes. So memory T cell is another type of immunity that you have. Antibodies are developed by B cells, and they can wax and wane over time. T cells is cellular immunity, which lasts for longer. So with vaccines, we also have T cell induced immunity, as well as the antibodies that protect us from infection. So yes, with Pfizer, with Moderna, we have T cell immunity as well.
Okay. And do we have alternatives for children who's allergic to the vaccine?
Right now, Pfizer and Moderna vaccine, some children may be allergic to one but not the other. We recommend that parents speak to their allergist. For adults, we have found that some people under controlled environments are able to receive the vaccine even though they're allergic. If they have an allergist present monitoring, it's given very slowly and they will respond. But the best advice is please talk to your allergist so they can see what exactly the child is allergic to in the vaccine, and if that is present in one or the other, and they can advise accordingly. If a child has had an allergic reaction to the first dose, we will not recommend the second dose.
I see. Okay. And also, where can we find this information in other states, and how can we as an organization and individuals try to get more information out to our communities about the COVID vaccine?
Yes, we have encouraged that this is a fight that we are all in together. This is one of the situations where if the virus is hiding in any one person, none of us is safe. So we have encouraged people have been very, very vocal about misinformation. People have been aggressive about promoting misinformation, and people have not been as aggressive in promoting the success stories. So if you're vaccinated, I think it is a good idea to share your own story, because we have folks on Twitter posting 10, 20 videos per day, scaring people, and creating a lot of concern. And we're not hearing a lot. If there are 7.5 million people that have received these vaccines, hearing their stories and will also be very powerful to help people see that this is normal, that many people have received these vaccines and are doing well. So we want to encourage people to share your story in whatever way you find easy, not necessarily to go around on a campaign and saying, I want to squash all the misinformation, but just so people see that it is real, that people are vaccinated in New York City and they're well. just to normalize vaccination. We also want you to be aware of where resources are that can help people who are interested in additional information. We have data on our website that is updated daily. It has data on who has died. It has data on what number of people are in the hospital. It has data on what number of cases we're having per day. Because many times people don't believe that COVID is here or present. So there is information that is available on a daily basis. When people say, oh, someone has died from the vaccine, everyone who dies in New York City gets a death certificate. So if you die from COVID, it cannot be hid. If you die from the vaccine, it cannot be hid. So, and there is a record of how many people are dying from what. So just knowing where information is available and what resources can be shared with people can be very helpful. We also want you to know that the CDC has a lot of information, frequently asked questions that can be shared. So we encourage everyone to please participate in this. Let us watch out for our friends, our neighbors, our loved ones. Many people just need additional information so they can make up their mind. And the more of us out there that are helping people feel comfortable and heard, I think the better it is. We know that many parents are worried that, oh, this is new, I want to wait for a while. We want to reassure them that it is the exact same vaccine that we have been given for the last 2 years. It's just a smaller quantity for children. And children get a lot of vaccines. I mean, children are experts in vaccination. If you're a parent out there, you should know that children get up to 19 different vaccines by the time they are 5, and they are well. So vaccines are not strange to us. We've had 200 years of vaccination history. And so we want people to feel confident, and please share your story is what I would say.
Wonderful. And one last question. We have a very serious issue with monkeypox right now.
Yes.
Will this overshadow COVID's priority?
I will not say it will overshadow. At any one time in New York, we are dealing with a host of health challenges, and we don't want any to overshadow the other. But COVID has by far been the biggest threat to us in a century. So COVID is going to stay with us for a while because the virus is not letting up. Like I said, we have had highs and lows, peaks and troughs, and it appears that, you know, another variant is on its way. So COVID will continue to be a priority for a while. Monkeypox has also emerged as a new threat. Right now, we have over 100 cases in New York City. That's more than we've ever had in the history of this country of monkeypox. We are working very hard to get information out to people so people know what to do. We now have vaccines, very limited stock of vaccines available. And so you folks can now make appointment for vaccination. As at now, monkeypox is still limited to the social networks of those who identify as bisexual or men that have sex with men. This is transmitted through close personal contact. So it is not a sexually transmitted infection. It is transmitted through contact with the skin lesions and close contact. So those who have had unprotected or close sexual contact within the last 14 days with multiple partners or with new partners that they're not very familiar with are eligible to be vaccinated. So we want to get the word out that you can protect yourself from monkeypox. If anyone has skin rash that develops pus over a while and then scabs over, please talk to your provider and find out if it's monkeypox or not. And if it is monkeypox, the best thing you can do is isolate. I also want people to know that all of the cases of monkeypox we have to date, none has been hospitalized, and they have all recovered after 2 to 3 weeks.
Okay, thank you. Thank you.
Right.
Very informative. Thank you so much for being part of this seminar today.
I put a link in the chat for the New York City Department of Health data page, and I'll put also a link in the chat for monkeypox update, so you can check out information there as well.
Thank you so much. And if there were any unanswered questions, we will send it to you via email, and the team, everyone here will receive, all the panelists will see the answers. Thank you so much.
Thank you, everyone. Please stay safe.
Thank you so much, Dr. Ige and Patricia. This was such a wonderful town hall. We got so many questions answered. We will be sending out the slides and the recording a little bit later. Just wanted to also thank the rest of our Community Health Worker Research and Resource Center, our partners at NYSEAL and the PRC, and of course, the New York City Department of Health and Mental Hygiene. Could you please share the next slide? And also just wanting to invite everyone here to our webinar on Tuesday that will be at 12 o'clock with Dr. Anna Burstein, who is an assistant professor here in the Department of Population Health. And she will be talking about existing and emerging COVID-19 variants in New York City and how they can affect reinfections and the current COVID-19 pandemic trajectory. Everyone should be getting the link via email, but also apologies, I will drop it down into the chat momentarily. But again, thank you so much. And I'm just gonna launch one more poll right now, which is about our webinar today. Thank you, Amy. It's about our webinar today. Please respond. It's anonymous, but it's very helpful for us as we continue planning our future events. So please take the time to do that. And thank you, everyone, for all the work that you're doing, for getting our communities vaccinated. It's very important work, and I hope everyone has a wonderful rest of the day. Thank you.